Good morning, everyone. It is my great pleasure to present Dr. Becky Andrews. Dr. Becky, please take over.
Hi. Oh, that really was brief. Okay. Well, hi. I'm Dr. Becky Andrews. I'm a naturopathic doctor and acupuncturist in Austin, Texas. And it's been a really great pleasure to work with Dr. Ron over the last few weeks, sort of collaborating on different cases dealing with brain function. And he graciously invited me to come join you and present to you today. And he wanted me to share with you some of the way I think about brain health. And so I guess we'll take it from there. Ron, was there anything else you wanted them to know about me before we started?
No, I think that's great. We're just so glad to have you here. Please continue.
Well, thanks. So another thing that I didn't warn Ron about when he asked me to do this is that I've been a faculty member at medical schools and acupuncture schools for the last 10 years. So I sort of am a compulsive teacher. And he said, throw a 5-minute presentation together. And I was like, So instead, it's probably going to be a 15-minute presentation, maybe a little bit longer, because I can't help but teach the whole thing. So we're going to start with, oh dear, the arrows are not working. Oh, they are on delay. Okay, here we go, for reals this time. So the first thing I wanted to do is, when I treat, I feel like I need to know how things work when they're working right, so that I understand what's gone wrong, so that when I treat, I can be really, really specific about treating the thing that's gone wrong and try to get things back to where they're supposed to be. So the first thing that I wanted to talk about is, in the big picture, how does the brain work? So the brain in the big picture, obviously it's really complicated, but in the big picture, it's a network of densely packed nerves, and those nerves send both electrical and chemical signals to each other. On the electrical end, we've got charged ions going across membranes that essentially turn into an electric current that goes down the length of a nerve. And then when we get to the end of the nerve's got to communicate with another nerve, and that's where the chemical communication comes in. And the chemical communication can get divided up very briefly into neurotransmitters, which are amino acid based chemicals that transmit signals from one nerve to another. And then also cytokines, which are a huge variety of chemicals that are basically the language of cells. And so that communication happens both inside the nerve cells and outside the nerve cells, communicating things like there's inflammation, or there's damage, or there's an infection, or everything's great, keep going as usual. So that's what the cytokines sort of do. They let the cells know about their surroundings, basically. So what do we need for healthy brain function? So the first thing we need to know about the brain is that it has enormously high energy needs. The only other organ that uses as much energy is the heart. And in physiology, energy needs translate into how much mitochondria there are in the cells and how much energy they need to produce for the cells to function normally. So mitochondria are sort of called the powerhouses of our cells. And what they use to create energy is oxygen in large amounts, and large amounts of nutrients, both B vitamins to make the chemical reactions happen, and minerals that actually allow electrons to run through the mitochondria and create the stuff called ATP. So without enough minerals, and one of the things I didn't put on there is CoQ10. Without minerals, without oxygen, without B vitamins, without CoQ10, the mitochondria can't run at their full speed, and we'll start to get a lag, and that can express as brain fog, or slower cognitive function, or lower metabolic activity in the brain cells. So that's what's needed for the mitochondria. The cells themselves also have needs for healthy fats. Both the cell membrane is made out of fat, but also in the nervous system, the myelin sheaths that are along the stretched out arms of the cells, the axons, those have these little fatty deposits on them called myelin. And those are also made out of fat. So without enough healthy fat, the physical structure of the cell isn't solid enough and isn't healthy enough for it to function optimally. The cells themselves also need vitamins and minerals. And then, of course, we need amino acids to make the neurotransmitters that the cells use to communicate with each other. We also really need sleep for the brain to function well, and we need hydration. We can't have a dehydrated brain. We have to have enough liquid and fluid for everything to float in appropriately. So that's the big picture of how the brain works and what our brain needs to work. So what happens when things go wrong? So unfortunately, our brain is fairly fragile. One of my teachers described the brain as essentially a Ziploc baggie full of mayonnaise to explain just how fragile the brain is physically. So traumatic brain injuries, like concussions or hitting your head, the brain can be very, very easily bruised or damaged. And one of the things that happens that people don't necessarily register is you don't actually have to hit your head really hard. If you're in a car accident and you just get whiplash with your head going forward and back really fast, imagine that Ziploc baggie full of mayonnaise. It's going to slosh and hit the front of the skull and then slosh and hit the back of the skull. And that's enough to pull at all the little fibers of the nerves, and it's enough to cause a bruise on the brain. It's a coup, Connor coup. So basically hit. So those can happen a few times in someone's life, and then 10 years later, they can start to develop cognitive issues because of those old injuries. So small accumulated TBIs is something that is really getting a lot of attention these days in medicine. So this is what football players and boxers and military personnel, they experience a lot of these, and we're starting to see that is responsible for the severe depression, some of the PTSD, some of the anxiety disorders that they develop years after their activities. And we know that football players and boxers and soldiers often end up with a lot of brain injuries and often end up with really severe psychological issues that are difficult to treat. And this is one of the reasons why. Similar to TBIs is hypoxia. So hypoxia means not getting enough oxygen to the brain. And one of the most common ways that this can happen is people having sleep apnea or even severe snoring. That means the entire 8 hours that they're trying to sleep, they're getting less oxygen than they should because their airways literally being blocked off and on, off and on, off and on. There are also this is sort of on people's radar now, and it didn't in a way that it didn't used to be, is that a lot of people are born with dental structures that mean that their airway is less big, it's smaller than it should be, it's more limited than it should be, which makes it hard. And that just thinking about it makes me feel like I've got to take a deep breath. But it means that people are getting less air than they should on an ongoing basis. Now, in some people, this can be severe enough to cause brain problems. If you can imagine 10 or 15 or 20 years of not getting enough oxygen, what that's going to do to the mitochondria in the brain. So that's also a big deal, and it's very, very common basically in the entire developed world. And we're starting at, this is very old data from the 1920s, but it's starting to come back into the medical discussions that structural change in the skull has to do actually with eating a refined food, processed food diet. And when parents or when mothers eat a whole food, high fiber, no processed food when they're pregnant, their children are born with wider palates and more space in their sinuses and more space in their throat. And they actually breathe better, and they have better cognitive function and stuff like that. So it's a super interesting area that we're starting to look at again. Another one that often falls under the radar are infections. So there are a lot of viral infections that can actually infect the brain. One of the most common ones would be herpes simplex virus. That is a virus that lives in the nerves. And if you get the herpes virus anywhere on your face, those nerves are actually in the brain. And so you can end up, as terrifying as this sounds, you end up with herpes virus actually in the brain. There are other infections like meningitis that affect the nervous system. And then I call them the weird bugs. So all the infections like Lyme disease and tick-borne illnesses, many of them infect the central nervous system as part of the body that they act on. And they're going to cause inflammation in the central nervous system and sometimes in the brain. And the one that really flies under the radar often are dental infections. So if someone, say, has an infected root canal, or they had a tooth pulled and it doesn't heal quite right, and they end up with a closed off infection, they call it a cavitation. Those are actually far more common than people realize. And, those infections, bacterial infections, are sitting there, inches to millimeters away from the brain. And that constant inflammation and all of the pathological substances are being created by that infection are literally drifting up and into the brain, and that can cause enormous amounts of cognitive dysfunction. And those are really easy to miss. Even severe gum disease can cause that. So that's worth noting, worth putting on the table, worth keeping on the radar. A little bit more simple than that, and a little bit less scary, and certainly easier to fix, is nutrient deficiencies. So if someone has a poor diet, or if someone has a great diet but has so many issues with their digestive system that they're not absorbing their food and not absorbing their nutrients, you can end up in a situation where you don't have enough B vitamins and minerals and CoQ10 and antioxidants and things like that for your mitochondria to run correctly or your cells to run correctly. And just like in the rest of the body, that can affect the brain as well. I often see people who are vegans or vegetarians that don't get enough protein, and then they don't make enough neurotransmitters, because those neurotransmitters are built out of the amino acids that come from protein. So, and if they don't have enough amino acids and they don't have enough neurotransmitters, they can end up feeling sad or depressed or anxious or have OCD or attention deficit, things like that. That one is relatively easy to fix compared to some of these other ones. Hormone dysregulation. So this is another big one that the holistic and functional community is paying a lot of attention to. So not having enough thyroid hormone, the main thing that thyroid hormone does is it turns on, it's the gas pedal for the mitochondria. So when there's enough thyroid hormone, that active thyroid hormone binds to a receptor on the mitochondria, and it tells it to go, burn calories, make heat, make energy. So if we don't have enough thyroid hormone, that automatically means that our mitochondria go more slowly. And then that leads us to one of the main hypothyroid symptoms, which is brain fog and depression and slow thinking and poor memory. And not everybody with hypothyroid has those symptoms, but many people do. And so as we've just seen, there are a lot of other things that can cause those symptoms, but if hypothyroid is there, it can make a big difference. Similarly, our sex hormones like estrogen, testosterone, progesterone, those all also have effects on the brain. On a basic level, some of them are pro-inflammatory and anti-inflammatory, but they also have metabolic effects. And the third really important one that often doesn't get thought of as a hormone, but it is insulin. So having enough insulin, but let me back up. Little piece of context here. So our mitochondria burn calories. They burn, and their preferred fuel is sugar. And so we need to get some sugar into our diet. It doesn't have to be refined sugar. It can be complex carbohydrates. Those are much better. But our body will eventually break that down into single sugars that they can run through the Krebs cycle. So we need to have some carbohydrates, and we need insulin to get those carbohydrates into the cells. Now, if there's too much carbohydrate, there's too much refined sugar, the insulin levels keep going up, trying to get that out of the blood into the cells. The insulin itself starts to do damage to the surrounding tissue. It's extremely, extremely pro-oxidant. So too much insulin will actually cause oxidative damage to the nervous system. Too much insulin also turns off some of our key repair mechanisms that our cells have. So, you know, we don't want to starve, but we do need to have a balance when it comes to our calories and our macronutrients like carbohydrates, fats, proteins. So that's another one to keep on the map, and one that I think is getting enough press that probably a lot of people are starting to realize there's often blood sugar, insulin connections with dementia and things like that. So one of my favorite things, something that I've spent a lot of time looking at in the last 10 years, is looking at genetic Snips that lead to abnormal enzyme function. So that doesn't sound quite as neuro as it actually is. So everywhere in our body, when we have to turn one molecule into another molecule, that requires an enzyme. And those enzymes have to be made by our body. And our body makes those. There's like little genetic blueprints throughout our DNA that are the blueprints for all those gazillions of enzymes that have to be made. Everyone has some blueprints that are off by just one molecule. And those are called genetic Snips. It's the SNP is for single nucleotide polymorphism, but Snips is easier to remember. So when you have a SNP, it means that the blueprint for one of your enzymes has one spot that is coded incorrectly, one tiny little change, and it produces an enzyme that is just slightly slower or slightly faster than it should be. And what that can mean over a lifetime is that you end up producing less of something or more of something, and then that can cause biochemical slowdowns or speed ups in different pathways. One of the places that I spend a lot of time looking at this is when it comes to neurotransmitter production and breakdown. So I work a lot with people that have, you know, mild to moderate mood issues like anxiety or depression, or mild OCD-like symptoms, and attention deficit. And often when we look at the pattern of what their symptoms are, I can look at that and know that they've got Snips in certain areas. With all the new genomic mapping that's happening, we can actually get genomic maps, and it can show us where these Snips are. And the cool thing is generally speaking, we can just give the nutrients that those enzymes need to work at their very best potential. And that's usually enough to sort of unclog the system and get things rolling and get things functioning well enough that the person feels good again. One of my other favorites to work with, and this dates back to my earlier practice in Seattle, where I did a lot of work with environmental medicine. And I still do some now, but I'm a little more limited in Texas in what I'm allowed to work with. But that's toxic exposures. So heavy metals, street drugs, some prescription drugs, and the big one here in Texas is mold. So all of those things have the ability to bind to or block pathways and change the chemical milieu in the brain and dramatically change how it works. So the prescription drug piece, I feel like Ron is sort of an expert in that. And so I will defer to him to discuss which ones of those do what and when we should use them, when we shouldn't, and how to decide. Heavy metals, it's actually a fairly straightforward way. So any metal is like a mineral, meaning it carries a charge. And the heavy metals can actually plug themselves into places where healthy minerals should be, and then they don't do the same thing. And so they can directly impact electron transport and directly impact nerve signaling in the brain. So and they're ubiquitous. I mean, we're all exposed to heavy metals, and I don't necessarily think that everybody needs to be treated for heavy metals, but in some cases, that is the central part of the story. The other thing to know about heavy metals and chemical exposures in mold is that they also impact the immune system. So they can cause scenarios where they make the inflammation go high, and then they break the mechanism that allows you to lower the inflammation. They can also break the mechanism our body uses to fight infection. And it means that the infections are allowed to go on and on and on, and our body isn't able to fight them off. And then the third piece is that both mold and heavy metals and like environmental chemicals like pesticides and stuff like that, those can also affect the endocrine system. And we've already talked about how hormones can affect brain function and neurological function. So they're bad mofos, man. You know, they're powerful, and they're all around us. One of the things that I deal with a lot here in Texas is a very moldy place. And when mold is everywhere, it's in the environment. And in the environment, it doesn't tend to bother us more than maybe allergies when we're exposed to, when the levels in the ambient air get high, we might get a little sneezy or itchy. But when mold grows inside of a building, there's a couple of things going on. One, they are different kinds of molds that grow in the building. When they grow inside of a building, they tend to make more mycotoxins, which are these little, they're almost like toxic gases that are released. And the molds release those because they feel threatened when they're growing inside of a building, and they tend to make people a lot sicker. Mold has a really powerful, both pro-inflammatory impact on the nervous system, as well as a really powerful suppression of the innate immune system. So the first part of the immune system that you need to fight off infection, it really shuts that down really powerfully. And mold is fairly insidious, so it can be hidden inside of walls. And, so I see a lot of that, and I treat a lot of people that have these sort of mysterious, their whole body aches, and they've got pain and joint pain and digestive problems. But they also have severe brain fog and memory problems and insomnia and anxiety and depression and maybe even nerve pain in their body. And it will turn out that 80% of that is the mold that's growing in their bedroom wall. So it's a big one, and it is often not on people's radars. So I'm kind of on a campaign to get people paying attention to that and thinking about it as a possibility. And then the last one I figured was worth mentioning is dysregulated cleanup and repair. So our cells normally have a process where they sort of shut down operations, they slow down their metabolic rate, and they clean out toxins, they clean out infections, and they repair their DNA. The process is called mTOR. That mostly happens during sleep. It is lowered if you aren't getting enough oxygen. It's lowered by low atmospheric pressure. Toxins get in the way of that, infections get in the way of that, and insulin also gets in the way of that. And so if we don't have our regular cleanup and repair, then we start to accumulate damage over time to our nerve cells and our brain cells. And that means they don't function as well over time. Okay, sorry that slide took forever, but that's the big picture map, and probably one of the more important slides. So digging into that a little bit, as a naturopath, a lot of what I look at is inflammation. So one of my favorite terms for that is called brain on fire, which is the name of a famous book by one of my medical heroes, Mary Ackerley, who's a psychiatrist in Arizona, who was one of the first psychiatrists to openly recognize that mold was creating a lot of the symptoms in her patients. So inflammation is a major driver for many cognitive and psychological issues, for memory, focus, depression, anxiety, insomnia. We even see in a lot, but not all, cases of psychosis like schizophrenia. And we have a lot, we're developing a lot of evidence that things like dementia, Alzheimer's have, that a lot of those people, it turns out, have infections, and they have like long-term inflammation that is causing the long-term process that can lead to dementia. Yeah, okay. And then inflammation can be caused by injuries, infections, toxic exposures, and high blood sugar and insulin, which we already kind of covered that. So there it is again. And then what happens on the other side if the brain doesn't have enough activity? So one of the things, Ron sort of, at least what I know, Ron, is his focus is looking at EEGs, which is the electrical activity in the brain. And so, sometimes the areas of the brain will be too active, too much electrical activity, and sometimes it won't be active enough. And so when it's not active enough, we get hypofunction. And that can be another big driver of cognitive dysfunction, right? And so hypoxia can lower the rate of activity because we don't have enough oxidative exchange to make the reactions work. Past injuries where a part of the brain got so badly bruised that it sort of shut down to protect itself and then didn't ever get enough nutrients and oxygen back into it for it to turn back on. So we'll see when there's just certain areas that relate to a past injury, we can know that hypofunction can be due to, that football player running their head into things over and over again. And then toxic exposures can also cause hypofunctions in certain areas, but those will, toxin exposure, drug exposure, things like that, those will often cause more global hypofunction. And then, we've talked about how the mitochondria is connected to all of that. And the hypofunction essentially boils down to a combination of either lower electrical activity or less neurotransmitter activity. This is probably a good time to pause and talk about the fact that there are neurotransmitters that are stimulating and neurotransmitters that are sedating or calming. The stimulating neurotransmitters are the catecholamines, so dopamine, norepinephrine, epinephrine, and also the other big strong one is glutamate, and that's the one that says, take in data, pay attention, attend. Its opposite is GABA, which says it's the filter. It says it's our primary calming neurotransmitter, and it says we don't need to pay attention to that. Ignore that. Don't send that signal. Belay that memo. So it's the filter. Serotonin and melatonin are also calming neurotransmitters up to a point. Serotonin has a threshold where if it gets way too high, it becomes a stimulating neurotransmitter. But that's sort of the big picture, though. So it's good to know that the neurotransmitters don't fall into one main group. There's two separate sets of function. I feel like I've already talked about the brain self-repair, the mTOR process. Again, it's more active during sleep. It can be inhibited by lack of sleep. It can be inhibited by toxic exposures, high insulin, low atmospheric pressure, low oxygen. And again, if it doesn't happen, then we get these small accumulated injuries that never get repaired. And over time, that will show a slow progression towards dysfunction. So how do I treat the brain? Or how do you treat the brain? So for me as a naturopathic doctor, part of the core philosophy of the type of healthcare that I practice is find and treat the cause. And that can be distinctly different than find and treat the symptom. So sometimes we'll see a symptom and we'll just plug in something to make that symptom go away, but the underlying cause is still there, which means that you'll either need more and more and more treatment for that symptom, or the issues will express in other places. So for me as a healthcare person, I always really, as close as I can get to understanding what is the deepest cause, right? And so let's use depression, or somebody has recycling negative thoughts. And so that sometimes gets labeled as anxiety, sometimes gets labeled as depression, but recycling negative thoughts is always due to low serotonin. Nothing else causes that particular pattern. So, okay, I have a symptom. The cause of that symptom is low serotonin. Now, would serotonin just randomly stop being produced? No, the body doesn't just randomly break. So we have to ask, why? Why is the serotonin low? Is the serotonin low because they have inflammation? Yes, okay, there's inflammation in the brain. Well, why? The brain doesn't suddenly become inflamed spontaneously. So now we're looking at symptom, cause of the symptom, cause of the cause, and then we kind of keep going down. What's the cause of the cause? What's the cause of the cause of the cause? It gets a little silly, but eventually you kind of want to find that root, the root. Is there an infection? Is there mold? Is there an old head injury? Is there hypoxia? And this is another spot where we also want to pause and appreciate the power of and. So it's often not just one thing. There's often multiple pieces all layered on top of each other that are producing these symptoms. And to get real, true healing, we've got to find all those pieces and do our best to address them and resolve them. And sometimes they're not completely resolvable, but if we can resolve completely 2 of them and make an improvement in 2 others, then we're going to get better function. The next question I ask myself is, are we hyperstimulated or hypostimulated? Sometimes we can tell that by symptoms, but sometimes we can't. So when we get to the far ends of hypo and hyperstimulation, the symptoms start to overlap and start to look the same. A really good example of this, I think one of the most outstanding examples of this is in a child that is expressing extreme rage and like snap rage. Well, they'll be fine and then suddenly they're raging. You can see that in a child that has deeply hypo-functioning brain. You can also see that in a extremely overstimulated brain. And that's where neurotransmitter testing and EEG testing, that's where those become absolutely critical. And to know if we're dealing with something that's too high or too low. And then looking at the neurotransmitters and the neurotransmitter patterns. And then, knowing that if somebody's got OCD, it means that their dopamine is getting stuck and not turning into norepinephrine. If they're always in fight or flight, they probably can't break down their catecholamines and they're sort of swimming in adrenaline or epinephrine. Again, the recycling negative thoughts, that's going to be low serotonin. If somebody has what I call brain cringe, and sensory stimulation just makes them cringe like fingernails on a chalkboard, that's too much glutamate. And so there's a few little distinct things that you can grab onto that'll point to the neurotransmitter patterns. And you can also confirm that by looking at SNP maps and looking at genomic mapping. And then you have to ask why. Why are they this way? Is it because of the SNPs? Is it because of SNPs plus nutrients? Or is it because of something else? Is it because of an injury? Or is it because of hypoxia or something like that? So finding and treating the cause is the middle. So once I sort of, and finding the cause sometimes is a long process. It's not like that happens instantly. So on the journey, as we're trying to find and treat the cause, we're going to consider nutrient status. We're going to make sure the cells have healthy fats, omega-3s, especially DHA. We're going to make sure the brain has enough cholesterol. We're going to make sure there's enough vitamins and minerals. We're going to make sure there's some CoQ10 going in. The Krebs cycle specifically needs NADH. If we think that they've got some metabolic challenges, we might want to, instead of just giving B vitamins, we might want to give NADH directly. With amino acids, usually the best results come from knowing exactly which neurotransmitters are low and supplying the amino acid raw materials to make those specifically and not give all of the aminos at the same time, at least until their symptoms are better. And then you can supplement with, steak, something that's a broad spectrum, get just protein. And then that provides all the amino acids in an even amount. But when there's empty spots, you want to fill those up before you give broad spectrum support. And then giving support to all the little enzymes. And one of the things I didn't mention before is for an enzyme to work, it always has at least one B vitamin and at least one mineral cofactor that it needs for it to function correctly. So making sure the enzymes have all of their vitamin mineral cofactors that they need to work. The next step along the way is addressing toxic exposures. I should mention, I actually, these are not in random order. There's you kind of have to do these in this order for it to work well. I mean, there's a little wiggle room, but you can't detox if you don't have nutrients. And you can't fight infections if there's toxins. So these are the next few slides are in this specific order for a reason. So if you know there's exposures, you want to identify them and get the person away from them to the best of your and their abilities. Sometimes they can't move. Sometimes they don't have money for remediation. So you figure out what you can do to lower the exposures as much as possible. And the field of environmental medicine, like the detox is not a quick, brief thing. That's like a whole weekend workshop. But there's a lot we can do to help people's bodies get rid of toxins once they're not exposed anymore. And then we want to address infections once we've taken the weight off of the immune system. So once it can work, then we have some hope of getting rid of infections and supporting the body in its immune process. Once those are out of the way, then we can start looking at balancing hormones. I can't prescribe them in Texas, but I'm definitely a fan of replacing hormones up to physiological levels when they're deficient. I'm not a big fan of going past physiological levels for most of them, but it's worth knowing that progesterone and DHEA are anti-inflammatory. Pregnenolone is also anti-inflammatory. Cortisol is anti-inflammatory. And then like estrogen and testosterone are pro-inflammatory. So those are important pieces to know, as well as knowing that they affect the metabolic rate of the cells. And then we want to make sure that we pay attention to blood sugar and insulin balance. And that kind of gets wrapped in with the hormone piece. So when people, if their blood sugar and insulin balance are off enough, that we actually may need to put them on a very low carb diet and help get their insulin sensitivity working again. And then we're gonna address inflammation. So remove the causes of inflammation, and then we can give anti-inflammatory supplements or medications like progesterone, pregnenolone, DHEA, omega-3s. So there are several omega-3s. The ones that our body actually uses to lower inflammation are EPA and DHA, and they're the parts of fish oil. So the EPA does sort of inflammation in most of our body. DHA does inflammation in the brain, or it lowers inflammation in the brain. So that's the specific part of fish oil that is the most helpful to lowering inflammation in the brain. The brain still needs EPA to function as well, so don't ignore it. Don't take DHA alone, but you do want to make sure there's robust amounts of DHA in the fish oil supplement that you're using. Turmeric and Boswellia are two of the most famous anti-inflammatory herbs. And what we found is that sort of marinating the person in those, giving them lots and lots of turmeric and Boswellia, that will actually cross over, that anti-inflammatory process will cross over and help lower the inflammation in the brain. Turmeric also seems to be one of the things that can help get toxins out of the brain, which is super interesting. And then like vitamin D is really important for anti-inflammatory processes as well. There's a lot more there, but those are the top 4 really famous ones that really no anti-inflammatory process is complete without. And then once all that is done, then you can improve oxygen status. The CPAP, airway improvement, and breathing techniques, those can be put in earlier. But hyperbaric oxygen can be a really, really profound healing modality. But what I've found and what my teachers have found is that if you put hyperbaric in too early while there's still an infection, while there's still inflammation, it can actually add to the oxidative damage and actually make things worse. So HBOT needs to come in, near the end of therapy, once the damage is cleared out, once the oxidative stress is not happening or is as minimized as you can get it, then we can bring in low pressure hyperbaric oxygen. And then we also want to pay attention to improving cleanup and repair mode. Again, this part can probably be put in earlier, but if it hasn't been addressed at the end, we can address it. One of the reasons I usually leave it to the end is because there's, if there's an infection or damage or hypoxia, trying to make this work when in the context of something that's blocking it is sort of a waste of time. So that was sort of my thinking for why I put that at the end. And then the last thing I wanted to talk about is what I'm going to say. I really should have put this in quotes, emerging therapies. These ideas are not actually new, but I feel like they are just starting to be folded into the larger discussion. Many of these things, so like acupuncture is thousands of years old. Photobiomodulation, it's not new. People have been using light therapy for decades at least, if not half a century. But it's just starting to get some traction in the research world. Using IV intravenous to deliver nutrients, that is something that's starting to gain a lot of popularity, and probably really didn't start getting used. I think that, trying to remember when Dr. Myers, he was one of the first doctors that did that up in Boston, probably would have been in the 1980s, was maybe some of the earliest application of this. But in the last probably 2 or 3 decades, this has gotten, using high dose IV nutrients to force nutrients into the cells against gradients has gotten a lot more focused and precise and sort of artistic. So I think that's a valid therapy. There are a lot of different microcurrent therapies that can be used to kind of get electricity kind of moving through here. There are a lot of different acupuncture and electroacupuncture techniques that can both get more electrical activity happening, more metabolic activity, but also we actually have mapped now that specific frequencies of microcurrent can increase different neurotransmitters. So that gets super exciting as well. So I just wanted to make sure those, again, were on people's maps to sort of look, know what things might be out there that they can grab for home therapies, or can, maybe lower cost or lower level interventions that could be really helpful. So I think that wraps everything up. That was my, as fast as I can do, big overview of everything you need to know about the brain.
Well, you
and
did
then that's me.
absolutely.
That's my practice.
Great. This is our contact information. Becky, what a wonderful presentation, and a lot more than I think people were expecting. But this is, I like your point about we really need to get to the cause of what's the underlying cause of everybody's issues, and they can be quite complex and something we all have to look at and be aware of. So this is just to present this information. Becky is available. There's a contact information, anything. If you have a need for something in this area, or you have questions, you can address them to this. And then maybe if you want to make the trip up to Austin, there's your another option as well. So we're going to take.
It's worth knowing that I do a lot of remote work. So it's, if people we can do phone and video. I obviously can't do acupuncture over the phone, but certainly, we can look at snip maps. We can assess a lot. I have patients in, I have a lot of patients I've never met in person. So that is an option if the drive is a little too much.
And can you order blood work? Can you order these micronutrient testing and everything like this?
That's a really good question. So technically in Texas, I am not allowed to diagnose or prescribe because the Texas doesn't recognize my license. So unlike Seattle, where I'm a primary care doctor, here I have to use workarounds. So I have either I will give a list of labs that I'd ask one of their current providers to order for them so their insurance can cover it. In Texas, there's a lot of open access labs. So sometimes I will utilize those and so I can kind of make a request to one of these open access labs. And then if the patient can cash pay, then the doctor at that open access lab will order the blood work. Because I'm an acupuncturist, I do have access to some of the functional kit tests that people will like take home and do a saliva test, or they can take home and do a poop test or something like that. So I do have access to those as an acupuncturist, as a licensed acupuncturist in Texas. And then like a lot of the, I'm sorry, my tea is maybe very phlegmy. So the, like a lot of the mold testing, that can actually be done. Those are mostly self-service things as well. So I can help people get connected to the right labs to help them figure out like, do they have mold in their body? Do they have mycotoxins in their body? And testing their house themselves to get some basic yes or no questions before that gets passed on to professionals. So I guess I have kind of a hybrid system here in Texas.
Well, we have a lot of doctors down here in Houston area that we can work very closely with. And let me ask you a hypothetical. If somebody called you up and they did a Zoom session and you did your assessment and everything, you could possibly identify which test you would like to see ordered, and then we could possibly take that to their individual practitioner and see if they would order those tests, correct?
Yes, I do that a lot. So, I like, I at the end of each visit with my patients, they get a printed treatment plan of everything we discussed. And then, and at the top of that, if there's labs that we want to ask their doctor to order, there'll be a list of those. And usually the rationale is pretty transparent, but if it's not, I will often write a quick little paragraph to be like, I want to see this because I suspect this.
Okay, great. That's fantastic. And I think the one
but I do have to be careful to make it not look like I'm trying to diagnose them, that I'm more treating the whole person and looking at whole health. And
sure,
there's a fair amount of hand waving that has to happen.
Stay in your own lane, right?
Yeah, I'm not going to lie. It's fairly frustrating having been, having had full prescriptive medical rights in a different state.
Well, one advantage,
but it is what it is.
One advantage we've got now is that we're all used to Zoom, and so that can make us. They don't have to drive to Austin; they can get the service, and we can find out from that. So, we're going to conclude that part. We'll wrap this up, record it, and we'll broadcast it then. Thank you so much, Becky. Appreciate it.
Thanks, everybody, and thanks, Ron.
All right, what I'm going to do is